Hi, my name is Michael Johnson. This scenario is for contemporary intensive paramedicine, the demonstration of treatment and management of tachyarrhythmias. So can you hear me?
Yep. Hello.
What's your name?
Francois.
Francois. Hi, Francois. My name's Michael.
Hello, Michael. Good, thank you.
Can you tell me why you've called the ambulance? What's going on?
I've just had a bit of residual chest pain right in the middle of my chest. Really quite heavy. Feels like my heart's beating out of my chest at the moment.
Have you ever had this before?
Yeah, I have actually. I've got a bit of history of going into Middlemore with a racing heart. Yeah.
Okay. All right. And so when did this start?
About 15-20 minutes ago. I called you straight away.
Okay. Good. Are you feeling short of breath at all?
A little bit. It's just hard to get a good breath, you know.
Got any medications yet?
Yep.
Just while you're talking, I'm just going to stick some sticky dots on your chest.
Yeah, I'm on some medicine, some for blood pressure, I think, and other ones for some cholesterol. There's a whole bundle of the buggers, you know.
You rattle when you walk.
Yeah. I'm a one-man pharmacy.
All right, so I'll just do some checks while you're talking to me, okay? So this all started about 15 minutes ago. Started racing. Let's go. So at this stage, your heart is beating quite fast.
Yeah, I told you that.
Yeah, no, I know you feel it, but you're right. Yeah, some people lie to us. What I'm going to do is a full set of vitals on you, okay? So I'm going to take your blood pressure, have a quick listen to your lungs, and then take a wee small prick of your finger, right? And then we'll talk about our treatment options.
Okay.
Okay. So Greg, I've just put you on some oxygen here, right? That's just on 2 litres, all right? It's just to give you a bit of supplementary oxygen while we're doing in the rest of our checks, okay? Oh, sorry, Francois.
Yeah?
You all right?
Yeah, I'm fine.
Okay? Oh, God, you stopped talking to me.
Sorry, mate.
Francois, I'm just going to stick some sticky dots on your chest, okay?
Yep.
Just doing a 12 litre, okay?
I know the drill. Had this lots of times.
Okay. And cool. So at this stage, Francois, our 70-year-old male, has a blood pressure of 80 on 60. He has a heart rate that appears to be regular. He at a rate of 170. His temperature is 37. He has a respiration rate of 18, a BGL of 7.6, and is saturating well before the oxygen on about 97%. I've just got him on 2 litres at the moment, and with his GCS of 15, his hypotension, as well as our rapid rate, I'm deeming him at this stage to be moderately compromised. And also at this stage, I think about getting back up on the way, being a single crewed resource. We can always stand down and back up, but with his chest pain, his myocardial, or signs of myocardial ischemia, it's likely that despite our treatment, he will still require transportation to a hospital. Okay, so this is Francois' 12 lead. What we can see from the 6-second strip down the bottom there is that we've got a rapid ventricular rate. That also appears to be regular. So my initial sort of provisional diagnosis would be that this patient has SVT with aberrancies, or ventricular tachycardia. Due to the QRS being about 0.12 in duration, and there being no discernible P waves, also with the patient's level of consciousness and his history of, from what we understand, chemical reversion in hospital, it's more likely that this patient is in an SVT rhythm as opposed to a VT. So yeah, at this stage we'll go with SVT with aberrancies and treat accordingly. Cool. So at this stage what we've done is we've gained large bore IV access in a site proximal to his heart, so like somewhere like an ACF, and we've also got our resuscitation gear with the bag valve mask and airway already measured, and the pads attached to the patient. Francois?
Yeah?
Yeah, what we're going to do now is we're going to try the Valsalva maneuver. What it does, it requires you to put your lips around this syringe here.
Oh, I've done that before.
As hard as you possibly can.
Yeah, I know the drill.
You know the drill? Okay,
yeah.
So when you do push, I want you to seal your lips completely around it and push as hard as you possibly can. Do you understand?
Yeah, I know it. I've done it before.
Okay, so we've got you lying down, which is good. Stick your lips around there. Here we go. Blow as hard as you can. Good work. All right. How do you feel?
Oh, bit dizzy now, but much the same.
Much the same, okay. Cool, and so for the purpose of the demonstration, we'd then repeat this another time, and failing the reversion with the Valsalva, we'd then move to our chemical reversion with our adenosine. Alright, so what we've got here is adenosine, which is used in the treatment of SVT. The preparation that we carry in the ambulance with St. John in New Zealand is 6 milligrams and 2 mils. We've already tried our first line of treatment, which is our Valsalva manoeuvres. Failing that, we try 6 milligrams in a rapid push followed by a 20 mil normal saline flush. And then failing that, if it still hasn't reverted, we go for double of the first lot, which is in 12 and 4, with again another rapid or large bolus flush, 20-30 mils. Of course, that's what we're going to do now. I've got my adenosine here. If I had a partner, not saying that Francois is not my partner, but I could get Francois or the patient to check my drug off with me, or if I had a partner, get him to do that as well. Cool, so Francois?
Yeah.
Yeah. You still with me?
Yeah.
Good. Just tell me what that little number says there. The expiry date?
The 18th of the 2nd, 2018.
Good, thank you. Hey, with your heart, have you ever had any heart transplants?
No, it's still mine, mate.
It's all yours?
Yeah, my ex-wife didn't say so, though.
And have you ever been in any sort of funny rhythms apart from the rapid rhythm? Any heart blocks? Have you heard that before?
No, don't think so, no.
Okay. And have you ever heard of sick sinus syndrome?
No.
No? That's good.
Is that when you got a head cold?
Head cold in your heart.
Oh, okay, no, never heard of that.
No. Okay, so what we're going to do now, Francois, is I've drawn up my adenosine, which is the drug they gave you, I'm assuming, in hospital.
Yep.
And what I'm going to do is I'm going to push it fast. As you can remember from last time, it makes you feel awful.
Yeah.
What it does is it calls ventricular standstill, which means your heart essentially stops beating electrically for a while before then the natural pacemakers in the heart have that break and re-kick and come back. So it might feel like your heart stops for a little bit, but it will revert back to normal. Do you understand?
Yeah.
Okay, so I'm going to give you a fast push in your arm here, the IV I've already set up, and I'm going to give you a fast push of just saline to keep it going all the way to your heart.
Okay, sounds good.
Okay, so stay nice and still for me there. And the last two questions I'm going to ask is, ever had any asthma or have you heard of COPD before?
No.
No, good. Okay, that's all right. All right, so I've got my preparation there. All right. I've also got my 20 ml flush drawn up into a 30 ml syringe. All right, ready, Francois?
Yep.
3, 2, 1. Now flush. Pushing that really fast.
Ooh.
You alright, Francois? Keep talking to me. Yeah. Francois, are you still with me?
God, that feels awful.
Yeah. You back?
Yeah.
Good. Squeeze my hand for me. Good. Hey, Francois.
Yeah. Yep.
Guess what?
Tell me.
We got you back.
Ah.
You're in a normal sinus rhythm again, which means your heart's beating just the same as what mine would.
I can tell it feels a lot better.
Good. Okay, so do you still have any residual pain in your chest at all?
Yep. It hasn't gone away completely.
Okay, so what number would you give that? 0 being no pain, 10 being the worst pain you can
Oh, not a lot, like a 2 or a
like
3.
A 2 or a 3, okay. And is it going anywhere else or the same right there in the middle of your chest?
Just in the middle there.
Okay, any funny feelings in your jaw or down your arm?
No.
No? Alright, so what we're going to do now is I'm going to retake all your vital signs. I'm going to take your blood pressure again, do another print of your heart.
Mm-hmm.
Okay, do another 12 lead.
Yeah.
And we'll just keep that oxygen on you for now.
Sure.
Okay, and...
Oh, This feels great.
Good. Alright, so what I'll do now is I'll do another full set of vitals, including a 12 lead. And because he's still complaining of some residual pain in the central chest region, non-radiating, we're still going down the lines of the patient could have some myocardial ischemia, which could also show up on the 12 lead that we do. So at this stage, we'll keep our backup coming towards us in the essence that he is going to be transported to a hospital for a review. So at this stage, with the backup already on the way, we'd clear up all my gear, prepare for extrication, and yeah, thank you, Francois.
Thanks. No worries.
All right.
Thank you, Michael.
No, thank you.
Thank you.
Stop it.